I'm Dr. Tracy Stecker, and welcome to the Choosing Help podcast. Choosing Help presents conversations about courage, connection, and the transformative power of asking for support. Through candid discussions, expert insights, and real-world stories, this podcast breaks down stigma and opens doors to understanding. Join our community committed to compassion and courage. Because when we choose help, we choose life. This is Dr. Tracy Stecker, and I'm joined today by Dr. Taylor Rodriguez. We're going to talk today about help seeking among racial and ethnic minority groups. Dr. Rodriguez is a clinical psychologist at the University of Mississippi and an expert on help seeking behavior. So, what we know is that the majority of individuals who are having mental health or substance use issues do not seek help. And we know that the rates are even lower for racial and ethnic minority people. So, could you run us through the numbers a little bit about what's happening there?
Yeah, absolutely. It's a good place to start. Like you said, most people in general are not seeking help, right? But when we break that down by group, if we're thinking of white adults as kind of our majority group, we see about 58% are with the mental illness or utilizing treatment. So a little bit over half
Hmm.
of white adults who need it are getting the treatment, right? Um, those percentages drop for pretty much all racial and ethnic minority groups. For example, if we look at Latino adults specifically, about 44% of those with any mental illness are seeking treatment. For Black adults, that drops down to about 39%. So a little bit around one in three that need it are actually getting to treatment. And I'll say too that these are stats for groups that we know have like a documented or reported mental illness. And I would imagine if we're thinking even broader of people who aren't contacting at all, we don't have documented mental illnesses, we don't have kind of reported difficulties for everyone who is struggling, right? And so if we're thinking kind of more broadly, I would imagine those numbers are even lower.
Yeah. Do you know the numbers by chance for substance use disorder? Are they comparable?
So I don't know them specifically off the top of my head. I do know that those numbers that I just cited for any mental illness are separated from substance use treatment specifically.
Hmm.
But I don't know what the stats are exactly.
Okay. But
Yeah.
we can assume that they probably follow the same trend.
Yeah, definitely. I think that, when we talk about barriers to mental health treatment support, we
Yeah.
talk about them similarly across kind of all difficulties, regardless if it's substance use, depression, right, anxiety, all those things. So yeah, I would imagine that we're kind of seeing similar trends there.
Well, it's a great segue. So, talking about the barriers, what are the barriers? What are the thoughts associated with help seeking?
Yeah, there are so
Mhm.
many of them. And I think when it comes to minoritized racial groups, there's a lot of beliefs around this idea that um, treatment or mental health care in a formal way is not for them,
Mhm.
that it's not for people like me. Maybe it's seen as something for white or majority groups. I've had a friend who was seeing someone, a young black woman who said, "No, that's for white people." Like it took me a really long time to show up here, and I think it really speaks to this idea that um, in long-standing history for mental health care. Our treatments were developed with and for and researched with white people, right?
Mhm.
And so over the years, it's not very likely that we've seen as many people that look like us, of these minoritized racial groups, who are getting treatments, who are included in kind of psychological research, even for these treatments. And so, this belief that it's not for me, right, is kind of, I think, stems from this history of being sort of not included in those developments and not included in those. Um, Kind of marketing even around like
Yeah.
mental health care. I think it's also kind of this extension of like maybe they'll all be sort of the same, right? Like this idea that it's not for me. And what I think of for mental health is like kind of this one size fit all approach that's wasn't is not um, uh, gonna fit my context and my individual experiences. People aren't gonna understand me, right, in this context. And if we
Mhm.
don't think that they'll understand us, if we don't think that we can get these experiences that match what we're struggling with, why would we go, right? There's this kind of this hesitation of trust and wanting to talk to somebody that might not get us, right? And
Yeah.
so those are the kind of the two first ones that I kind of think of.
Yeah. But those are pretty big ones. If you're thinking
Yeah.
about, it wouldn't even come to mind. It's not for me. That's
Hmm.
that's a big barrier. It doesn't even come to mind that treatment exists for them. And then if you did go, you wouldn't be received. You wouldn't be understood. They wouldn't try and understand you as an individual. It would just be
Hmm.
the one size fits all
Yep.
protocol treatment.
Absolutely. And I think there's some uh even stats and background we can think of that would drive some of those beliefs, which is that like we know that at least in the field of psychology, most of our workforce is white, right? And so the odds of finding someone that looks like you, for instance, is a little
Mhm.
bit lower. It takes a little bit more work to find someone that looks like you, that you feel like might have similar backgrounds or kind of perceptions of the world. And so there are those like practical barriers of if you do want someone that is similar to you in some way, you might have to work a little bit harder for it, right?
Right.
And so
Yeah.
I think that kind of feeds into it.
I don't know if this is the time to say it, but I feel compelled to say it. That they do exist, though. If you want someone who looks like you, who is
Absolutely.
of your same background, same gender,
Mhm.
same race, same ethnicity, even psychologytoday.com, it exists exactly for that, to find somebody who might fit you as an individual, whoever you happen to be. Looking for that person in your region is an option on that website.
Yeah, there's a ton of websites, and I can plug them towards the end if that's better.
Oh,
But there are also some websites that are specific for different minoritized groups that have tools for helping you find therapists who are with that same background, or therapists who work within your same background, that kind of thing. So there's
yeah.
definitely more tools out there now to be able to find what you're looking for.
That's excellent. You said you were going to say it at the end, and I jumped ahead. Sorry.
No, that's
Um,
fine.
what are those websites called?
Yeah.
Might as
So
well give a shout out now.
yeah, if we want like a comprehensive list, there's a really good resource on the American Foundation for Suicide Prevention's website that links the specific page is for minoritized communities as a whole. And then
Okay.
it kind of bullets it by population, and they have
Okay.
a list of resources for each population. Um, some specific ones are inclusivetherapists.com.
Okay.
That one is kind of a mental health community centering the needs of minoritized and underserved populations in general. And they have a tool for finding providers. They have more specific resources that are developed with these communities in mind and for these communities. Um, there's a website called Melanin and Mental Health, which is also very similar. Therapy for Black girls is very specific for Black girls and women and has a therapist finder tool. They have a podcast, they have a blog, they have extra resources there. And then similarly, we have things like Therapy for Latinx, which is that's the website title. Asian Mental Health Collective. So there's a lot of these specific groups um, and organizations that have been popping up and working really hard to collect what is out there and to also bring together sort of a database of providers in your different areas that
Yeah.
can kind of help.
I love that. Thank you for providing that information. So
Yeah.
now we have a potential answer for the first barrier, which is
Hmm.
not for me.
Yeah.
They won't understand me. So there are resources available that are for you, and from people who will understand you potentially.
Yeah.
What are some other barriers? I know those were the two big ones and they're
Yeah.
enormous. What are some other barriers?
Yeah. Some of the other things I think of are sort of more on a individual level of how it could feel um, like you would be weak or that you would be maybe judged if you were to
Yeah.
seek mental health care, right? Or to talk to someone about what you're struggling with. We know that a lot of our racial and ethnic minority groups have this really deep value of appearing strong and kind of pushing through tough times, right? We've had to for a long time. It's been a really longstanding discrimination, racism, and all of these things that have led to having to rely on those strengths. And at the same time, that's exhausting, right? And so it's like really um, can what even when you get to the point of saying, okay, yes, I have those resources, it can also feel a little bit incongruent with your value of wanting to be strong and wanting to come off strong. And I
Yeah.
think a lot of people kind of have to also jump over that barrier of saying that it doesn't necessarily mean that there's something wrong with me or that I'm weak in accepting or seeking out some of that support.
Yeah, so the strive to always be or appear perfect or
Yeah.
having it all together, just overcoming that is also a pretty substantial
Mhm.
barrier to treatment. How can somebody overcome that thought? What are the reasons? I know I'm throwing that at you. I'll join you.
Yeah,
I'll
no,
join you on that one.
I think it's important. So I think that there's a lot more examples of how strength can look differently, right? And there's the flip side thought of this is that it's a hard thing to do to admit and to show your struggles, right? And
Yeah.
to say, um, this one's really heavy for me, right? This is a really heavy thing for me to carry. And so it's a show of just how strong you can be and being vulnerable enough to say that that's really hard, right?
Yeah.
Um, that flip thought is not maybe that doesn't come as naturally, right? But there, do think that there's more and more examples of this. And I mean, we just talked about a number of resources, and those websites also kind of highlight different community level resources as well. And I think
Hmm.
seeing those, right, seeing other people that are struggling, being willing to talk about these things and being willing to connect you with resources that could also help kind of combat this idea that everyone who is doing this is weak, and that means I would be weak if I went.
Yeah. I think of it too. One another way to approach that thought, if you're having that thought, is we're not all experts. We were not born to be experts at everything. And if you're striving to learn as much as you possibly can and be competent in all areas, be competent in life, sometimes you need a little extra information. So you go to the experts. So it
Mhm.
doesn't matter what you're dealing with. Maybe you have anxiety and you're struggling with anxiety for some reason. The world feels scary and you're just anxious all the time. It all is feeling overwhelming. Maybe you're struggling with depression. Maybe a traumatic event happened. Maybe you're struggling with grief and prolonged grief. Maybe it is a disorder, struggling with substances or pain or sleep. I mean, there's a variety of issues that might arise over the course of one's lifetime, and you don't have to be an expert on all of it. Yes, you can consult Dr. Google and look up a lot of stuff, but
Yeah.
sometimes it really does require digging in with an expert who can help you as an individual work through. We're not talking about therapy for life on any of these situations or disorders. We're talking about getting a little bit more information about how you might be approaching that particular issue, working through it, and then moving on with your life. So one of the things I do like to talk with people about who are having that, I can't admit I'm struggling. Admitting to myself that I'm struggling is hard, and admitting to somebody else is just too much for me. It's okay to get more information. It's okay we're all learning. It's okay to consult with an expert for a short period of time, take that expertise, and then move on with your life. Have faith in yourself. You'll take that data and move on. It does not mean that you're mentally ill,
Yeah.
right?
I
Hmm.
love that. Yeah, and I
Hmm.
think what I really like about what you're talking about is that it doesn't have to be forever, right? And it doesn't have to look the same for everybody. It doesn't even mean you gotta keep doing it for a year even, right?
Right.
Um,
Right.
it definitely
I
could just
say 8 weeks. 8 weeks is
yeah, 8 weeks
eight
is
weeks.
solid. Couple months, and just kind of touching base with someone, and all, and through that process, you decide what's working, what's not, right? And you can kind of decide where you go from there. But if you don't take that first step, right, you just continue to
Yeah.
kind of hold on to all of the things that have been really weighing to be a lot, right?
Yeah. Yeah, that's a heavy load.
Yeah.
Yeah. All right. So going back to the barriers, we've got it's not for me.
Mhm.
People won't understand me as an individual. Stigma and judgment. You named one more.
Uh, did I? I don't I think we're tracking. One other thing I had in mind though, um, especially for, the populations and communities that we're talking about, is this idea that we like should keep things within the family or like
Yeah.
not share too much information with outside people. And this is really common in Latino communities I think of that are very like family oriented, community based, kind of just want to keep things within the group.
Mhm.
And so that can kind of create barriers for being saying, okay, yeah, I want to open up to this other person about this thing, and especially if it's a family-based stressor, right?
Yeah.
And I think like one way to kind of think about help seeking and what we're talking about is that you don't have to tell your whole life story to everyone that you meet, right? And you don't have to explain things that you're not comfortable explaining at that time. And so I think it goes back to what we were just talking about is that you get to decide what you get and how much you're getting of it and how much you're sharing. And you can start off small, right? Test the waters, talk about little things that feel a little bit more easy to open up about too.
Yeah. Yeah, I can't we can't emphasize that enough. The treatment is confidential, and I know in some of our smaller communities it can get sticky there. But there are even workarounds around that.
Mhm.
Um, Treatment is confidential. A lot of people report that they don't want to get help because they don't want people to know. And the
Mhm.
truth is, if you don't want people to know, you don't have to tell people. You really don't. There's ways to get help without letting the world know, your
Mhm.
world know.
Yeah, exactly.
Okay. Um, One of the questions I did want to ask you, and we kind of keep touching on it because
Mhm.
I wasn't linear.
You're totally fine.
Um, what help is available? So I don't know if we want to specify help for certain groups of people or if we want to specify for certain disorders. But let's say you are a minority and you are struggling with something, whatever it happens to be, and you don't want people to know. What's the first step? What would you recommend somebody do?
I think that if we're talking iterative steps, I
Hmm.
would always recommend going to one of these websites that we're talking about, kind of
Yeah.
searching things up on your own and gathering information about what the help could look like, right? And you can think about specific therapies or specific treatments, but at the end of the day, like taking that first step of saying, like, okay, there's this thing that's really been lingering for me. I could probably use some support, but I don't really know what that would look like. Your first step could just be information gathering, right? And kind of looking at what other people are doing. And especially if you don't really have people in your circle that you want to talk to about it too.
Right.
Um, a lot of these you could also um, connect with even if you don't connect with a provider, but connect with like the community pages and kind of read about what other people have been experiencing, what other people are going through. I sometimes encourage people to just ask questions generally instead of about their specific situation so they can get
Yeah.
information. So I think especially if we're really hesitant about getting too much into the nitty-gritty early on, you can
Hmm.
still get kind of a lay of the land and figure out what sounds kind of doable to you, and what sounds like a little bit of a leap for where you're at right now.
Okay. And then and so that's, taking almost an academic approach to it. Let's do some research first. Let's find out what's available. And then the reality is life sometimes doesn't let you plan for that. Sometimes it's just all of a sudden you are in crisis. You
Yeah.
can't even concentrate, much less, open up a website.
Mhm.
You're just in crisis. So, and you and I are both experts in the suicide world. So let's say somebody is more in the heat of the moment crisis. What would your recommendation be for somebody like that?
Right in the moment, my recommendation is to use a hotline.
Okay.
So the hotline that comes to mind is 988, right? And it is a national hotline and could be called, it could be texted, it could be chatted with, and you're immediately going to connect with someone who can be supportive. And, we can define crisis a number of ways. It could be like right now feeling like I'm in danger and I get, I want to keep myself safe, but it could also be I'm super overwhelmed and I don't know where to turn. And you can call them and say that, and they'll help
Mhm.
you kind of streamline your thoughts, help you with the info gathering and what are the next steps.
Mhm.
So yeah, that's my kind of gut reaction to this idea of like if I'm like right now
Okay.
struggling really hard and I don't know where to turn to, it's
Yeah.
kind of like a catch-all place that you could go to kind of help get things started.
Yeah, so let's say, for example, somebody's in a suicidal crisis, call
Mhm.
988,
Yeah.
or text, chat with them.
Hmm.
Um, and then we do know that potentially there are some differences for even for outcomes for people who are in racial and ethnic minority groups in terms of their help seeking for a suicidal crisis. If you call a hotline and you say, I am not going to live through today. Today is the day I'm going out. You are likely to get what's called a rescue,
Hmm.
which means that, and they will tell you this, they're going to go ahead and call the local authorities to help keep you safe, to help intervene, and have people come in and work with you. For somebody who's a minority, that might be a scary thing to know that the cops are about to come at your door. And it's because you've asked for help and you've said, I don't even know if I'm going to live through today. And they've prompted a rescue, and now you've got the police at your door. Now you're adding another layer of potential fear or thoughts or barriers to entering the treatment world. And I just wondered what you might what you might think about that and what we could recommend to people so that they're allowed to say, I'm in crisis and get the help that they need and not have an extra trauma on top of it.
Yeah, I think it's a hard balance, for sure, because at the end of the day, they they want first priority of the hotline is to make sure you stay alive, right?
Correct. Yeah.
Um, I
And
think
they can just talk you down. I mean, you
yes.
can use the responders just to your high heat. You just need somebody to hear you out for a second,
Mhm.
right? So
Mhm.
it could be used in that way. Just help sit with me for a minute while I'm flipping out.
Yeah. Um, I, I'm trying to think if so there are some locations that have other like more local hotlines, that are a little bit more specific to helping with minoritized communities specifically. And I just think it's going to be location specific because like you can have certain places that have like mental health units that are coming out instead of cops, right? But I think it's so variable when we're talking about talking to kind of a broad audience. It's harder for me to say, okay, like this is a place where you can go where you could say these things and guarantee like we can't I don't know that I would know of anything that we can guarantee that they're not gonna escalate if you say that you're not gonna live like through the rest of the day, right?
Right.
Um, do you know of any of those specific like hotlines or anything like that?
I don't.
Yeah,
No.
I don't know. I think it's tricky. Um,
I do recommend calling
yeah.
the hotline though if you are in some sort of crisis because you will get a responder who will sit with you and talk with you and you can be as angst as you need to be.
Mhm.
If you say the words, I'm not going to live through today, or I have the gun to my head, you're likely to get a rescue prompted. So, if that's true, you can let the responder know that you're really struggling and have them work with you in order to get linked to care. If you say, though, I'm going to do it right now, you're likely to have a rescue initiated.
Yeah, yeah, I think like it's helpful to at the very least have all the information, right? Like we want to know like what are the potential outcomes. And I think like th this scenario um is important to work through. And on the flip side of this, it's also important to kind of point out that you can use the crisis not in this like very acute state of
Hmm.
distress, right? Like the if you call and you want them to kind of just be talk to you, be with you for that minute and that kind of thing, um, you could do that. I've connected with people who use the crisis line to simply say, like, I want to find a therapist. Can you help me find a
Hmm.
therapist? So there's like a wide range of reasons that you could call and ways that the conversation could go.
Hmm.
And at the end of the day, it's good to know like the different decision points that the callers have as well.
Yeah. Yeah. And so that was kind of my point in that question. So you can approach, mental health treatment seeking in like you would approach anything. I've got this problem and I need to do the research. I need to find the
Hmm.
potential treatments, the treatments that would potentially work for me, that the providers that might work for me. So you can approach it that way. And then as with life, sometimes these issues emerge spontaneously and we don't have time to plan. And if that's the case, there are still resources available to you. I think Dr. Rodriguez has some really helpful websites where you can, even in the heat of the moment, find a treatment and a provider that might work for you as an individual. And then we have 988. We do have hotlines that you can call in the heat of the moment to get the immediate help you need. And hopefully it will reduce distress enough so that you can go back to that other approach where you find the right therapist for you.
Yeah, for sure. And I think too that it's important to plug like in this kind of continuum of options is that if you're in a position where you do have trusted people in your circle, you could always talk to the people in your circle, right? Whether that's church leaders, friends, family, your barber, right? Like there, you can have conversations that to connect with people and to get a little bit of support without also telling them a whole lot of details, right? You can kind of say, things like, oh, things have been stressful recently, or oh, um, this maybe you don't even say that you have things on your mind, but you're just wanting some sort of connection with someone, right?
Yeah,
You get to have choices in how that connection looks. But I do think that like there we don't want to overlook the importance of our community and the people that are around us too. And so something to keep in
absolutely.
mind.
Yeah. All right. So you've got a loved one and you notice that they're really struggling with some sort of mental health problem. The recommendation from you, you're gonna obviously talk with them. I know you. So I know you're gonna talk with them and you're gonna gauge, what's going on and then uh, how do they want to approach it? Where would you go next? So let's say they're saying, well, I'm not gonna get any help. I'm not going to talk to anybody because I don't want anybody to know. What would your next steps be? What would you tell them to do and why?
Yeah. Um, I think that people will be more resistant by someone saying, no, you need to do it. You need to do it. You should do this. You should do that, right? Like that
Mhm.
very direct kind of approach can make people a little defensive. And
Mhm.
so I think my response wouldn't be to say, no, you're wrong. Like you do need to talk to somebody. Um,
Mhm.
I think I might highlight that it's okay if they don't, it's okay if they do, and that I'm here the next time they need to talk about it.
Mhm.
Um, and then also kind of follow up with them, right? And so
Yeah.
not be worried about bringing it back up and waiting for, I think, especially if someone's really upset in that moment, it could be hard to like get to a problem solving mode, right?
Yeah.
And so waiting until things are a little bit more calmed down, where it feels like you could maybe open that conversation again, could also be really helpful.
Mhm.
Um, and familiarizing yourself with some of these tools. The websites that I mentioned aren't just for finding therapists. They have lots of a number of other types of resources. And if you are a little bit more familiar with it, I think you could be a little bit more comfortable having those conversations too. Um, yeah, those are the kind of initial thoughts I have about that.
Yeah, that's great. I mean, because what it comes down to are options. And
Yeah.
so, regardless of the scenario or the individual, there are options available. Talking with a loved one, talking with a community member, talking with a professional, finding the right option, whether it's a talk therapy or a medication or some other type of treatment available. There are options for most disorders. Finding out what they are in what with regardless of condition, finding out where they are, finding out the providers, finding out that for you you've got options and all you needed to know was where's the list. Where's
Yeah.
the list, and let me just think about it and think about what might work best for me. And
Hmm.
then also knowing that seeking help and finding an expert on some condition does not mean that you're weak or less than or defective. It means that you need more information in a certain area so that you can continue to grow, right?
Yeah. Yeah. Need more information. I liken it to, you know, uh, if you have like a broken wrist, right? Like you're not going to continue to write and continue to do things because it's going to hurt every time. And
Hmm.
so eventually you get to a point where it's like, okay, maybe I should put something on it. Maybe I should get a little bit of help. I don't know how to do that myself, right? So I'm going to
Hmm.
figure out how to do that. Um, and I think people are in general are more willing to do it when it's something so visible as a broken wrist, right? And I think, the message from this show in general is so important because um, just because things aren't as visible as a broken wrist doesn't mean that you can't use a little bit of an extra tool to help
Hmm.
you get back to writing, right?
Awesome. Yeah. Any last words?
Uh, Thank you for having me. I think these are really
Oh.
important conversations. And I do think that there's been more and more attention to how we as a field can be more responsive to the needs of these minoritized, historically excluded groups. And as an individual, if you're listening, I hope that at the end of the day, you kind of take away that you don't have to do it all by yourself. So.
Oh, thanks for being here with us today. Thank you for joining us on Choosing Help. And what we'll do is if you or somebody you know is struggling with a mental health or a substance use condition, and want more information, you can come to our website at choosinghelp.com and look at our resources tab, and we'll have these resources available. You can also contact us. And do you want to say some of those names again, just
Yes.
in case this is an audio, somebody just wants to hear it?
Absolutely. So, the American Foundation for Suicide Prevention has a website page. It's tagged for marginalized communities, if you Google that, and that'll all pop up. And then a couple of others are inclusivetherapists.com, melaninandmentalhealth.com, therapyforblackgirls.com, therapyforlatinx.com, and AsianMHC, which is mentalhealthcollective.com.
Awesome. Thank you so
Yep.
much.
Thanks.
Bye, everyone.